Similar to the maxillary molars, even mandibular molars are 3 in number in each quadrant. In this quadrant, although you're seeing 2 of them, mandibular first molar and mandibular second molar, because the third molar is not erupted yet or probably even have been extracted. Okay, so we don't know, but normally there are 3 molars in each quadrant. So again, 3 on each side of the quadrant in one arch. Alright, so that makes it 6 molars in the mandibular jaw. Okay, and the first molar is called as the 6-year molar. The second molar is called as the 12-year molar, and third molar, like I said in the last class, is called as wisdom tooth, which we do not see in this image. These are again the largest and the strongest teeth in the mandibular arch, and the main function is grinding. And here you should note that the grinding function happens when the mandibular molars comes in contact with the maxillary molars. That's when there is a grinding of the food in the occlusal surface. Coming to the nomenclature, in the 2-digit system, the first digit denoting the arch and the second digit denoting the number. For first molar in mandibular arch, it is denoted by the number 46 and 36, whereas second molar by 47 and 37. By universal system, you can see in this image the first molar by 30 and 19, and universal system for the second molar is 31 and 18. And in the Palmer notation system, denote the arch as the lower arch, and for the first molar write 6 on each quadrant and 7 for the second molar. Coming to the anatomy itself, very main important difference from the maxillary molar is that the permanent first molar has 5 cusps. We had 4 cusps in the upper first molar, whereas the lower first molar has 5 cusps. The 4 cusps which are common between the two are mesiobuccal, distobuccal, mesiolingual and distolingual. That is 2 on the buccal, 2 on the lingual side. But the extra cusp which we see in the lower first molar is the distal cusp. So I'll discuss in detail when we go to the buccal surface, but here you can see this is the mesiobuccal, distobuccal, and this is the distal cusp. And coming to the roots, again a difference. In the upper molar we had 3 roots, isn't it? There was a palatal root which was the longest and the strongest, followed by 2 buccal roots. Whereas here there are just 2 roots, and not just that, the roots are named differently as well because they are situated mesially and distally. So it is called as a mesial root and distal root. Let's go to the surfaces one by one. From the buccal aspect, again the outline is trapezoidal, the longer side parallel to the occlusal. The mesial contact area is located at the junction of the occlusal and the middle 1/3, and distal contact area is slightly more cervically located. From the buccal aspect, we can see all the 5 cusps. If you remember what I said at the end of the lecture for maxillary molar, I said that the lingual cusps in case of mandibular molar are slightly taller compared to the buccal cusp. So when we are looking from the buccal aspect, we can see all the 3 buccal cusps, yes of course, but we can also see the tips of the lingual cusp, as you can see here. On the buccal surface, the mesiobuccal groove divides the mesiobuccal cusp and the distobuccal cusp and ends in a pit, that is the buccal pit. The distobuccal groove separates the distobuccal cusp and the distal cusp. This small cusp which you can see here is the distal cusp, and this ends in a distobuccal pit. Okay, and the height of contour is located in the cervical third. The root, because it is bifurcated, meaning it is divided, it has a root trunk. So this portion where the root is undivided is called as the root trunk, and this is the point of bifurcation because there it divides into a mesial root and a distal root. From the lingual aspect, it is slightly smaller than the buccal surface because of slight lingual convergence, and there are two lingual cusps, mesiolingual and distolingual, which are divided by the lingual groove. Okay, and height of contour is in the middle third on the lingual aspect. From the mesial aspect, the outline is kind of rhomboidal because the crown exhibits a slight lingual inclination. Okay, the whole crown is kind of tilted lingually when it is compared to the axis of the root. Only two mesial cusps are visible, that is the mesiobuccal and mesiolingual. The distal cusps are not visible. The mesial contact area is shifted buccally, as you can see, and the mesial marginal ridge is visible from the mesial aspect, and only one root is visible. And what is this root? The mesial root. Okay. From the distal aspect, it is quite similar to the mesial aspect, except that it is slightly smaller in size. The distal contact area is a little bit more cervically situated, and it is larger. Cervical line is relatively straight. The distal marginal ridge, as you can see here, is located at a more cervical level compared to the mesial marginal ridge. The distal cusp is very prominently seen here. Okay, and of course we have the distolingual cusp, and both the roots can be seen because the distal root is slightly narrower compared to the mesial root. So the outline of the mesial root can also be seen from this aspect. The occlusal aspect or occlusal surface is roughly pentagonal in shape, that is, it has 5 sides, pentagonal. Okay, and the crown is wider mesiodistally compared to the width from the buccal to the lingual surface. Okay, and the sizes of the cusp from largest to smallest, the first or the biggest cusp is mesiobuccal, mesial and buccal. So this is your mesiobuccal. This is the largest cusp, followed by mesiolingual, distolingual, distobuccal, and the shortest is the distal cusp. That is the size of the cusp. And coming to the height of the cusp, can you tell me again which were the cusps which were slightly taller? Both the lingual cusps are slightly taller and almost equal in height compared to the buccal cusps, and these are followed by mesiobuccal, distobuccal and distal in the heights. So again, let me just repeat it to you. The size of the cusp, the biggest is mesiobuccal, followed by mesiolingual, distolingual, mesiobuccal, and the smallest is distal. And coming to the height, 2 lingual cusps are the tallest, followed by mesiobuccal, distobuccal, and distal. 3 fossa. The central fossa in the central portion, kind of circular in shape, and it is the largest and the deepest. Mesial triangular fossa located distal to the mesial marginal ridge, distal triangular fossa located mesial to the distal marginal ridge, and they're triangular in shape. Coming to the pits and grooves, there are again 3 pits. The central pit is located in the deepest portion of the central fossa, junction of 3 grooves, that is the mesiobuccal groove. Okay, this is the mesiobuccal groove, distobuccal groove coming from here, and the lingual groove, which is here. And the next pit is the mesial pit, again the deepest point of the mesial triangular fossa, and it is the junction of the central groove, mesiobuccal triangular groove, mesiolingual triangular groove. The third pit is the distal pit, deepest point of the distal triangular fossa, and is the junction of the central groove, okay, the distal lingual triangular groove and distobuccal triangular groove. Let's discuss the second molar of the mandibular arch. From the buccal aspect, you can see that there is a buccal groove which is dividing the buccal aspect into 2 cusps only, not 3 cusps like the first molar. There are only 2 cusps, and they're equal, nearly equal in size, mesiobuccal and distobuccal cusp, and the groove ends in a buccal pit. The height of contour is located in the cervical 1/3. Similar to the first molar, the roots are mesial and distal, but they can be shorter and situated closer together compared to the first molar. So this would be the difference when it comes to the root. This, as usual, is the root trunk, and this is the point of bifurcation where the root is divided. From the lingual aspect, again there is very little lingual convergence. Lingual cusps are equal in size, which are divided by a lingual groove, and the height of contour is in the middle 1/3. Mesial aspect is exactly like the first molar, except that in case of second molar it is slightly smaller in size generally. Distally, there is an absence of distal cusp which was present in the first molar, and there is no distobuccal groove because there is no distal cusp, and the contact area is very large and it is in the center. From the occlusal aspect, it is roughly triangular. Why? Because I told you mesiodistally it is wider and buccolingually it is narrower. So hence it takes up a roughly rectangular in shape, and it has a cross shape, the occlusal surface itself. There are 4 cusps: mesiobuccal, distobuccal, mesiolingual and distolingual, and they're all fairly symmetrical in their position on the occlusal surface, and they're all nearly equal in size as well, as you can see. And we can see the mesial and distal marginal ridge from this aspect. The fossa are similar to the first molar: central fossa, mesial triangular fossa and distal triangular fossa. Coming to the pits and grooves, compared to the first molar, major groove pattern is very symmetrical because there is a central groove which is running in the center like that. Okay, there is a buccal groove and lingual groove, these 3 combining together to form the cross pattern, and they all meet in the central pit, which is the deepest part of the central fossa. Let me repeat again. There is a central groove running across the center. The buccal groove and the lingual groove meet the central groove at the central pit to form a cross pattern. This we already know. Central pit is the deepest point of the central fossa, junction of the central groove, buccal groove and lingual groove. Mesial pit, deepest point of the mesial triangular fossa and is formed by the junction of the central groove. Okay, mesiobuccal triangular groove and mesiolingual triangular groove. And the distal pit again is the junction of the developmental grooves, that is the central groove and the distobuccal triangular groove and distolingual triangular groove. So all three of them meet at the distal pit. Type traits to differentiate mandibular first from the second. In mandibular first there are how many cusps? 5 cusps, correct? Whereas in mandibular second molar there are 4 cusps. Okay, and the occlusal pattern in a mandibular second molar is the cross pattern. And the first molar roots are divergent and widely separated, whereas in case of second molar it is quite situated close together and they are parallel or not very divergent from each other. These are the two differences. So one is in relation to the number of the cusps and the occlusal pattern, and the second one is the root, how they are divergent and separated. Arch trait, as you know, distinguishes the maxillary molar from the mandibular molar. So mandibular crown, if you remember, they're wider mesiodistally and narrower buccolingually. That's why it has a rectangular pattern when you're looking at it occlusally. Whereas maxillary crown are exactly opposite, because they are wider faciolingually or from the buccal to the lingual aspect compared to the mesiodistal dimension, and hence they are rhomboid in outline. Okay, and mandibular crown, if you remember, it tilts lingually, correct, at the cervical line, that is called as lingual inclination, whereas maxillary crowns are aligned directly over the roots. Mandibular molars have 2 roots, mesial and distal, yes, whereas maxillary has 3 roots, palatal, mesiobuccal and distobuccal. Maxillary molars have oblique ridge, which is a very unique identifying feature, which runs from mesiolingual to the distobuccal cusp, which is not present in the mandibular molar.